Let me talk few questions about angina. Question number one, angina is produced by an imbalance between oxygen supply and oxygen demand. Basically, oxygen supply reduce and demand increase. Which of the following drugs help to correct the imbalance between supply and demand? Answer is SC inhibitor, angiotensin converting enzyme helps. Not for all chest pain caused by myocardial ischemia. What are the non-cardiac cause of chest pain? Non-cardiac cause of chest pain is pulmonary embolism, pneumonia, and gastroesophageal reflexes. All is the cause of the non-cardiac cause of non-cardiac cause of chest pain. All. The New York Heart Association and Canadian Cardiology Society have described the grading criteria for level of angina. Angina that occur with usually vigorous activities or walking, climbing the stair. What the level or class of angina it is. So some patient has an angina even resting phase. Some people has an angina during the activities, exertion. When angina with activities we call class 2. A patient is a high risk for developing significant coronary artery disease are those who in the level 3 angina. To reduce the mortality, all patients with angina, regardless of the class, should be take aspirin. The dose is 81 to 325 milligram per day. The patient who have angina, regardless of class, who are also diabetic, should take angiotensin converting enzyme inhibitor. This medication prevent the conversion of angiotensin 1 to angiotensin 2. Angiotensin 2 is a strong vasoconstrictor and also release the aldosterone. So SC inhibitor block the formation of angiotensin 2, so indirectly causes the vasodilatation, decrease the blood pressure. Management of all types and grade of angina include the use of lifestyle modification to reduce the risk factors. Which of these modifications are appropriate for which reason? Both modification and the reason for it must be true for the answer to be correct. So management of all type and grade of angina, including use of lifestyle, and two, why we do this? Reduce the risk factor. Which of these modifications are appropriate for which reason? Reason is reduce the sodium intake to no more than 2400 milligram of sodium. Sodium increase blood volume and cardiac workload. Nitrate are especially helpful for the patient with angina who also have heart failure and hypertension. Answer is both. Beta blockers especially helpful for the patient with additional angina who also have arrhythmias, rhythm defect, rapid acting nitrate are important for all angina patients. Which of the following are true statement about the use? Take one nitrate tablet or spray at the first sign of angina. Repeat every 5 minutes for no more than 3 doses. So these 3 doses, we give them every 5 minutes for 15 minutes. After the second dose, if still the sign symptom is there, we should call 911. The chest pain is still not relief, go for emergencies. Isosolvit dinitrate, it is the vasodilator for long-acting nitrate given twice. The schedule for 7 a.m. and 2 p.m. because nitrate can tolerate, right? Or nitrate tolerance can develop. Combination for a long-acting nitrate and beta blockers, especially effective the treatment of angina because this additive effect permit low the doses for both drugs and their adverse reaction cancel each other out. Although they are often described as helpful in the lay media, which of the following therapies have not been shown to be helpful based on clinical evidence? So although they are often described helpful in the lay media, which of the following therapy have not been shown to helpful? It is vitamin E and A, coenzyme Q10, and folic acid. All is above. Drug chosen to treat angina in old adult differ from those of younger adult. So what are the difference? Consideration the risk factor for disease associated with and increase the aging. So risk factor increase with the increase in the age. Which of the following drugs have associated with increased the risks of myocardial infarction in women? It is estrogen replacement therapy. About the cost of anti-anginal drug therapy should be considered in drug selection because of all of the following except. About the cost, all of this is true except number C. What is true? Patients often require multiple drugs. A large number of angina patients are older adult and fixed income. Generic information may be cheaper. Generic formula, it is not true, not cheaper, even not come directly. Five questions should be asked during the follow-up of any angina patient. They include, has the level of physical activity associated with angina changed since the last visit? Situation that suggest refer to the patient in appropriate include. So all of them, what is all of them? when you prescribed a patient to go for the cardiologist, when chronic stable angina become unpredictable, when a post-MI patient is danger, it is important to save their life. When standard therapy is not successfully improve exercise tolerance or reduce the incidence of angina, we could refer them to the cardiologist.